The most rewarding part of my job is to be there for the patients at whatever level that I can be there for them. Be it be coming up with a treatment plan to kind of help cure their cancer or control their cancer, to be there to kind of help ameliorate their symptoms, to make connections for them with other providers so that way they can play a role in their cancer treatment and point them in the right direction with regards to not only their medical treatment but also their socioeconomic situations is a very important part of what I do. I did my medical school in India, and when I came here in the 1990s, that is one of the things that grabbed me when I was a resident in 1995, the huge difference that medical oncology plays in the role of cancer treatment. So that was a time where I was kind of not only learning about chemotherapy, but learning about the tumor biology. And then the latter half of the 1990s is when the first targeted drug, Gleevec, got approved with regards to treatment of CML. So I've been blessed to be part of this journey about understanding tumor biology and tailoring the treatment of cancer to the tumor biology since I arrived here in this country. And so that's what drew me to this field, is to be able to make a difference in the outcome of these patients. So cancer is such a major diagnosis that people usually are in a state of shock when I see them. And the first job of a medical oncologist is to explain to patient in layman terms what the diagnosis means and try to reassure them that we're there to support them in whatever way we can. So we have a huge team of people at Siteman Cancer Center. So while as a physician, I come up with a treatment plan for these patients, there are other personnel like my nurse coordinators, my nurse practitioners, schedulers, treatment room nurses, social workers, psychologists, you name it. It takes a village to make things happen, and they are all there for them to help support them through this journey. Patients come in different stages of their cancer with different medical problems, different symptoms, but the common theme is this emotional roller coaster that they are going through, where even the smallest of the cancer, the most benign entity, can sometimes kind of scare people. And that is the most important thing, is to reassure patients. So Siteman Cancer Center is positioned in a way where we not only are focusing on research and how we can improve the outcomes for these cancer patients, it is the people here where they make the true difference. And that's palpable for every patient who comes in through the door, where every physician who interacts with these patients truly care about these patients. We want to make sure we've done everything for these patients that we can. So I tell patients that the integral part of cancer care is not only cure, but it's also to provide comfort for these patients through this journey that they are going through, and we're there to be part of that journey. So Siteman Cancer Center and Washington University is amazing, not only at patient care, but also doing research in the clinical and basic sciences area. They've been at the cutting edge of medical oncology research for the last several decades, and I've been blessed to be part of this research where we are doing patient-centered research, targeted drugs, immunotherapy, and it all just took off when I was doing my training, and it became more about understanding the biology of the cancer and tailoring the treatment to the patient's cancer and the tumor biology. And so that's what kept me in Washington University. It is very humbling to be part of the patient's journey. You feel very blessed in your life to be able to kind of be given this opportunity to share that journey with those patients. You want to be there for them, and you see their bravery every day, where they come in knowing fully well the major diagnosis that they have, and you talk to them about the side effects, and they come in for every treatment knowing that they may have side effects again. And to be part of their celebration at each step along the way, to be part of the family to kind of take care of these patients, it's just very humbling and rewarding to be part of their journey.